That is Professor Shelley Mallett. She is General Manager, Research and Policy Centre, Brotherhood of St Lawrence, Melbourne, and Professor Fellow in Social Policy School of Social and Political Sciences at the University of Melbourne. Shelley has undertaken a number of roles in her life, including particularly work in the university sector, but also work with significant service providing agencies, including Hanover, Australia. Shelley is based in Melbourne, and I've had the pleasure of working with Shelley on a number of significant projects, and I look forward to hearing her presentation today. Over to you, Shelley.
Thank you very much, Andrew. And before I start, today we come together in this place at this time on the land of the Kaurna people. They've gone before us for thousands of years, and it's absolutely no shadow of a doubt that they will go beyond us. Their songlines stretch forward and back across this place of celebration, of renewal, of ceremony. And so it's important for all of us to honour this past, this present and this future. And I pay my respects to elders, families and descendants. So I want to thank you for the invitation to speak today about homelessness policy programs and new models to address homelessness in the 21st century. It's an issue that's very close to my heart, and been close to my heart, I guess, for the last 15 years or so. I'm well aware that for many people in the room, that's just a brief blip, that many of you will have been engaged in the issues around homelessness for much longer than that. I want to thank the Don Dunstan Foundation for the invitation, and of course the University of Adelaide through CHIRP. So I think we're at an important moment to pause and reflect on where we've come from in the homelessness sector. And in some ways I'm going to do a little bit of what Andrew's done, but maybe make some commentary about it as well. I think we're at an important moment in the homelessness sector where we have to think about what we can learn from the past, what we can learn from the present, and where we need to go to shape a new response to homelessness. Recently described in Melbourne in Homelessness Week by the Minister, Kevin Andrews, Federal Minister, as a moral blight, and echoes of Kevin Rudd there. So we're now 5 years post the release of the Homelessness White Paper, with a new government and a 1-year reprieve on the NPAH, while a new funding platform is being negotiated beyond this. And it seems to me, I don't know whether it seems to you, that we've been on a bit of a roller coaster ride in the homelessness sector. We've gone from relative ignominy to being a real focus, and now in a battle of survival. So clearly in half an hour it's not going to be possible for me to say all that needs to be said about homelessness policy going forward, but I'm going to give it a whirl. I'll try and speed up a bit because I would like to get to say something about innovation in homelessness programs, which is something that I spoke a bit about in Melbourne earlier this week, but I think they're a complementary piece of work. So, excuse me. Let's just look to the past briefly. And Andrew's just recently talked about SAP. But what I'd like to say about SAP, or the Supported Accommodation and Assistance Program, which was really put homelessness on the map, I believe, on the social issue map in 1985 when it was launched as the Commonwealth state-funded Supported Accommodation and Assistance Program. Now, this is not to say that homelessness didn't exist before then, but it became an issue of great significance that required social policy attention and programmatic response, a coordinated response. And it was established then as the last resort safety net for homelessness. And so what we had then is homelessness framed as a consistent, coordinated issue of concern with a coherent, or arguably coherent, policy and program response. This was further consolidated by the release of the Burdekin Report in 1989, which looked at youth homelessness, again profiling this national blight, and then subsequently with the National Affordable Housing Agreement in 2008 and 9. But let's just stick with SAP for a minute. It began as a program providing supported accommodation for the permanently homeless, with 3 broad sub-programs: general services, hostels and shelters and the like, women's services and youth services. But despite successive evaluations and attempts at reform that sought to expand the scope of service delivery from select populations like youth, women, chronically homelessness, to broader populations, families. We saw the emergence of families, for example. And it tried to shift the focus over a period of time from crisis responses to transitional housing and responses that promoted self-reliance and independence, and from secondary intervention to early intervention and prevention. So over a period of 23 years, there were absolute remarkable shifts, and many of us engaged in an effort to transform what it is that we could provide for homeless people. But each evaluation clearly recognised that SAP failed to deliver a systematic response to homelessness. So I think what I want to say is that I want to be really critical today, not because I'm criticising the fine work that people in services and agencies have done over a period of decades, but rather when you start looking at the systematic, you're starting to read a litany of some success, but certainly some failure. In short, SAP failed to deliver a long-term outcome for clients in housing as well as employment and training. And there are many reasons for that, and I just want to put a few of them. First of all, the thorny issue of housing versus support. Structurally, SAP as a program sat at arm's length from housing policy and programs within state government jurisdictions. So public housing sat at arm's length to homelessness often. And this reflected a fundamental division between housing services and support services. But at the heart of this division was the very way that homelessness itself was conceptualised as an issue. For the homelessness service sector, homelessness was less about housing and more about the complex issues that, if not caused it, then certainly exacerbated homelessness. Issues like substance abuse, mental illness, domestic violence, family conflict, etc. So at the heart of SAP and our configurations around SAP was this division between housing and support. And I think it's a kind of legacy issue that we've begun to shift in recent years, but nevertheless, when we get to thinking about where to in the future, we need to remember the seeds of this idea and do efforts to counteract it. There was also something of a conflation of the symptom with the cause. So there was a tendency to frame program responses around the symptom of homelessness and sometimes the trigger, for example, domestic violence, rather than some of the structural level causes. So there was a prioritisation within SAP around individual level causes with the focus on things like drug and alcohol, but a failure to grapple with the broader economic and institutional structural drivers of homelessness. Now, we've just heard Roseanne Haggerty talk about those institutional and service arrangements which are absolutely critical to achieve an outcome. And I think this is where some of our issues in SAP lay. There was also a segmented population response with poor overview of the system as a whole. So we had people working with the chronically homeless, we had people working with women, we had people working with youth, but in many ways it was quite segmented, even within homelessness itself. And so some of the key learnings that occurred across those domains weren't actually shared. And there were some big elisions in that. Children. We really only recently discovered the needs of children in the homelessness sector. There was an emerging reliance on data over the period, over 23 years of SAP. And of course we saw the AIHW's compliance data set, which was a great contribution, but nevertheless it had real problems. It was very input-output driven, but it didn't really allow us to look at outcomes. But the other thing about SAP is the very thing that gave us a priority and focus on homelessness also rendered us a residualised service system. And what do I mean by that? Well, we were not as big as those big mainstream systems like education, or we didn't have the profile of the statutory child protection service system. We had limited power to affect changes in other service sector programs in each state and territory. So we were a small program that was residualised. The other thing, of course, is that we failed to grapple sufficiently with housing, and that has been a relatively recent development within SAP and then later within the Rudd government white paper and the subsequent reforms. We had no coherent or consistent emphasis on social and economic participation. We dabbled. We had things like JPET for youth and an adult program, but we were dabblers rather than players in this space. We spent a lot of our time in SAP at the level of practice, emphasising managing people's problems because they were totally compelling, rather than managing their solutions with them. And I'll come back to that later. So let's fast forward to 2008 and 9, the NPAH. We had the white paper, as Andrew discussed earlier, and what it signalled was an unprecedented government focus on the issue of homelessness. So with SAP, we had homelessness put on the map. With the white paper, we had homelessness prioritised as the social policy issue of the government of the day. 3 prongs to it, as Andrew mentioned: turning off the tap, which was a focus on early intervention; expanded and improved service offer, which was housing and social and economic participation was in view in this; and then breaking the cycle, which was about rapid rehousing with support to move people out of homelessness quickly. So I would say with the white paper we had real vision and indeed understanding of homelessness. And if you go back and look at it again, as I did recently, you'll be reminded that there was real vision in that white paper. And the vision was around cause. So we now shifted our attention away from the individual cause to at least some acknowledgement of the structural level drivers of homelessness. And by these I mean housing, of course, but also, importantly, employment and income. We had an acknowledgement that there was systemic failure, and the systemic failure was the exits from all of those statutory care settings, including as well as universal services such as health. It had real vision about the effects of homelessness, actually. Unemployment, social exclusion, disengagement, and in fact, in South Australia, you've led the way in terms of reframing homelessness from a social inclusion agenda. And it had vision about the contemporary faces of homelessness. And by that I mean it saw children for the first time, really. And increasingly, it saw older people as well. And it pointed to, if not seeded, some solutions involving genuine social investment in this funding policy program. So we had the NAHA with the 4 partnership agreements hanging off it. And this recognised the structural drivers, as I said, and there was a big investment in housing, social housing for homeless people, targeted at homeless people. Didn't redress the fact that there'd been complete underinvestment for the decades earlier, but nevertheless it was an effort to try and redress it to some degree. There was also an investment in tenancy support, and as I said, that intersection between universal service platforms and other service platforms and homelessness. It recognised the need for an investment in employment and training, because 3/4 of the homelessness population were under 44 and most of them were not employed when they exited the homelessness service system. It recognised the need to mobilise mainstream services to engage with and address the needs of people at risk of homelessness. And I want to come back to this issue of mainstream because I think we're a bit stuck there. There was a recognition that practice reform needed to happen, and an effort to do that was through quality and standards. But I'm not so sure that we had great practice reform out of the white paper. And importantly though, and it maybe is sometimes forgotten, but I think for me probably one of the single most important things was that the leadership of the reforms sat with Prime Minister and Cabinet, and in particular through the Prime Ministerial Council on Homelessness, as well as FACSIA. Now, why is that important? It's important because they provide an authorising environment across government to drive change beyond the homelessness sector itself. And this means that at least, if not driving reform in other departments besides housing homelessness ones, that compels other Commonwealth departments to at least address the issue of homelessness in their policy and their programs. Now, I would say that we'll get to the failures of it in a second, but that was the single most important thing, I think, in driving reform. And we shouldn't lose sight of it as we begin to think about the NPAH into the future, or whatever its iteration. It had key targets, of course, and this is the first time in Australia that we'd really used targets to drive reform at a national as well as a state level. We had an improvement to the reporting data through IHW, and along with it, an unprecedented commitment to the development of an evidence base through research. Now, when I started in the homelessness sector 15 years ago, research was seen as really marginal to the efforts to address the needs of homeless people. And so this was a dramatic shift in my 15-year period. And this resulted in over 100 projects, and it seeded, of course, Journeys Home, which we'll hear about a bit later today. It had the recognition that prevention and intervention should be at the heart of the response, and that key transition points, i.e. from school to work, should be drive the way that we approach our policy and programming. It had a significant investment in rough sleepers because, as Roseanne quite rightfully notes, it was a moral blight, the fact that in such a developed country we had so many rough sleepers. And it did seed real innovation across the life course for children, for young people, for rough sleepers, for older people, as well as some cross-cutting innovation. But there were many successes, if you like, but equally there was many failures. And I guess I'll just name a few. While the Commonwealth led the white paper, each state developed its own implementation plan with a broad list of outputs, but such as street to home initiatives. This broad list of outputs, within them, only a very few were mandatory. And what that meant is that across the country, we had a dispersed and unfocused endeavour around how we were going to address homelessness. So in one state, you were going to prioritise one thing, and in another, something else altogether. And so we did not have a coherent response across the country, apart from things like Street to Home, that could really drive national reform to homelessness. And one clear example of this is the investment in children. So here we had it prioritised in the white paper, recognised as a real issue, but only 3 states elected to develop a specialist children's homelessness response. and only those in very limited locations. As Andrew was commenting before, we've had pilots and pilots and pilots and pilots, but no, these children's services were not taken to scale in any one of those three states: South Australia, Western Australia and Victoria. Moreover, they developed their responses more or less without reference to each other. We could make some criticisms of those responses, and I've just recently been working in an agency, Hanover, that has been running the children's services. But what I would say is, when I looked across nationally at our response to children, these programs had no clear links to the mainstream. No clear links to the mainstream. It's not that they didn't link to the mainstream, it's just that they didn't have a coherent response. While the white paper sets targets, these targets were not actually incorporated into the NPAH, and nor was data collection and the research focused on assessing the efficacy of the reforms against these targets. So, in a way, we set ourselves up to fail. There was an insufficient focus on Indigenous homelessness, even though we know that they're overrepresented. And I know from my engagement with the Prime Ministerial Council on Homelessness that this was an issue of great concern to them, because we actually needed to provide the infrastructure and support to existing Indigenous services to allow them to build the capability to deliver responses in rural and remote areas. And while we made some significant inroads, we didn't do enough. And when you look at the rates of where the rates of homelessness are concentrated and where the share of homelessness is concentrated, as I've been doing with colleagues Gavin Wood and others at RMIT, what you find is that it's concentrated in Indigenous parts of the country where there's high concentrations of Indigenous people. We did have an unprecedented investment in research and data, but actually we had such a diverse research agenda that there was no coordination and strategy and to that research agenda. Now that's a pretty bold statement, but what we saw was the proliferation of lots of projects, but projects that actually weren't harnessed to addressing whether particular programs were meeting the needs of homeless people, and in particular addressing the issue of, were we meeting the targets and why weren't we meeting the targets? So to my mind, we certainly built research capability across the country. We certainly brought new researchers into the space, which was absolutely needed. So it was a great capacity building activity. We'd had some great individual level projects, but were they harnessed to the reform agenda? I would quite simply say no. Not enough. We had links to the mainstream but I would say, and here I think is the real nub of the matter, and if I get time at the end of this talk, I'll talk a bit more about this as well in relation to programs. We had links to the mainstream, but the mainstream has been so narrowly conceived by us that I think this is where we really need to make a big concerted effort to think about reform. We think about the mainstream in terms of services, and so what we hear is integrated services, joined up services, wraparound services, holistic services, that our response to homeless people is really centred around the service offer that we can provide to them. But I would like to argue that is not just the mainstream. The mainstream, in my view, extends right out to the broader dimensions of community. And this means connecting to the service clubs, to the sporting and recreation, to actually integrating people into their communities. And why is that important? It's because of something Andrew said and Roseanne said, is that homeless people are not homeless first, they're experiencing homeless. They are people first, they're you and me. And do I want a holistic and wraparound response? No, I do not. I just want some of my basic issues dealt with, and then I want to be part of the ebb and flow of community life. So what does that really mean? That means a profound shift in what we do in terms of our service offer. If I get to it, I'll get to it. So where do we need to go to from here? Well, as Andrew and others have said, it's a particularly important moment. We've just had the unemployment figures come out, where we're seeing rising unemployment. We're seeing a radical change to the labour market as well as to the housing market. And so what the implications of that is that we are likely to see more people in precarious employment and more people in precarious housing and more people in both. So clearly, and we're at that moment, and we're also at a moment of renegotiating NPAHs and what it is that we offer to people. We're seeing an increase in private renters. We're seeing longer private rental. We're seeing greater percentages of low-income people experiencing housing stress. And as Saul Eastlake puts it, we've had in the context of, in this current context, but also in the past, half a century of housing policy failure. All this with a reduced funding, with a reorientation in some jurisdictions at least, particularly in Victoria, where I'm from, away from homelessness as the primary issue of concern towards some of its causes and antecedents. So homelessness is becoming much more marginal as an issue of concern to some of the other issues like mental health, drug and alcohol issues, domestic violence, etc. So we have this as well as an inability of the sector to deliver on its core expertise and its core mission, housing solutions. So I would argue that we've been pretty myopic as a sector. We've failed to properly identify and articulate our expertise, and we've failed to actually be able to leverage some of the relationships with other service systems, but more broadly with the community. Now, I'm being very harsh, but I think it's time for us to have a really critical look, if only to ensure that we can provide strong, good and effective services into the future in this altered funding and social policy landscape that we find ourselves in today. So where do we need to learn from the strengths and the weaknesses of the past? Well, I think I'd just like to make a few comments about some of the key policies that I think are going to be really important. I, for one, would argue for a renewed NPAH. I'm sure many people in this room would too. But it needs to be one with select and strongly mandated outputs focused on early intervention and prevention. We've got to stop people getting into homelessness because it's so much harder to get them out of it, especially in a funding environment where we've failed to be able to address the housing problems before us. So early intervention is absolutely critical. And given the profile of the homeless population, it needs to be with children, youth, families, etc. Which is not to say we should leave the others behind, but in terms of priority in early interventions, that's where I think it belongs. I think we need nothing short of a national affordable housing strategy, and it needs to be led by the Prime Minister. Because what we learnt about the NPAH sitting with Prime Minister and Cabinet and FAXIA is that you need that authorising environment to mobilise across government and between the government and opposition. We've got a national affordable housing crisis on our hands, as many of you know, and I don't in this room, so I don't need to rehearse that. But we absolutely have to fight and put a lot of our work and endeavour into coming up with a strategy to address this issue. We need tenancy legislation reform because, as we know, many of people, our children, our relatives, etc., are now in private rental housing, and people in low income, it's the tenure of choice. Or not necessarily a choice, but it's really what's available. And yet we know that low income and including homeless people are very marginalised from this because we have an acute crisis of affordable low income housing. So we need tenancy legislation reform in our jurisdictions. We also need Commonwealth rent assistance to work harder for us. It's not currently it's set against CPI, but we actually need it to be indexed against a new indicator, and we need it to have some flexibility. The rents in urban areas are not the same as rural and remote areas, so we need some flexibility to adapt it to those contexts. But because homelessness, in my terms, is more symptom than cause, broader reform is necessary. So I think it's time for us to think beyond the homelessness sector and homelessness policy. It is no longer good enough to leave that to others to do it. We have to insert ourselves into other major areas of policy reform. And why do we need to do that? Because nothing short of building human capital, building social capital, people's networks and links to enable them to get to participate, whether economically or socially, is going to transform their lives and enable them to lead sustainable lives. And so we cannot simply continue talking to ourselves in that, or to other services. So we need reform around income support, and I'm sure we need to increase the rate of social security payments to reflect the real cost of living. We need an alignment of pensions and allowances, and we need to increase the liquid assets threshold so that people in private rental can retain a reasonable safety net. What do we find is that people have to, in private rental, who find themselves on hard times and out of work and reliant on income support, they have to exhaust their safety net before they can really qualify for payment. And that puts them in a very precarious situation. We have to build people's financial literacy, and because many of the people that we see, have real troubles with budgeting, and if not budgeting, with debt. Now, I hesitate to say that because I think quite patronising of me to say that when I'm not living on a New Start allowance or a pension and allowance. I mean, some people have extraordinary facility to budget and manage it, but nevertheless, across the service system, what we see is people dealing with the issues of debt.
5 minutes, Shelley.
And finally, in terms of this, I'd say we need, crucially, to look at employment. As Andrew was saying, what we know from the research evidence available and experiential evidence is that our employment, our mainstream job services employment system is failing homeless people. What we know is that less than a third of this cohort find employment, and a third of these end up in the JSA within 6 months. So essentially what I'm saying is that the JSA is failing to deliver employment outcomes for homeless people. And the question is, how is it that those who can work but do not have the skills and capabilities to work will get those skills and capabilities? Not through the JSA, in my experience. So we need to design a new response, whether it's through JSA or outside of JSA, which builds capability through coaching, vocational guidance, stronger skill building, links with employers and labour markets, and rapid interventions. Okay, I just want to say something very briefly, if I may, about some of the programmatic responses and where innovation needs to come. And I apologise to those people who might have heard me in Melbourne, but I think I just want to shift a gear into the programmatic because I've developed a 12-point plan around what's required for a real investment in service development. And let's do it very quickly. We need to look for inspiration between the homelessness service system. We need to stop being myopic and look beyond our own service system for solutions. We need to be solutions focused rather than problem focused. We need to prioritise what people can do rather than what they can't. As a sector, I'd say we've been totally focused much of our effort on identifying and managing people's problems, and they're compelling, rather though than recognising and building their skills and capabilities and their networks with people to help them to build sustainable lives. That is a radical reorientation of the way that we think and approach service delivery. We need to develop strong conceptual frameworks for our work. In fact, when I look across it, I see a dearth of conceptual frameworks for the way that we actually go about our service development work. We've had a bit of trauma-informed, and I've been involved in advantage thinking in Melbourne around some FOIA work, but really there's a dearth of a conceptual in what we're doing, and we need to find that. We need to develop responses across the life course, because this will connect us to thinking about the mainstream. So if it's children, then what are the things that children need to achieve? They need to achieve early learning. They need to achieve connection to their community. These are the most basic things. But if we don't bring that life course approach, and with it a life transition approach through school to work, working age, if we don't have that front and centre in our mind, we'll drift away from the mainstream service response and the mainstream community response. We have to expect our mainstream and universal services to provide a response. Now, Winteringham in Victoria led the way in this. It's been a lone voice, and as I said before, I completely missed the boat for about 12 or 13 years, where they kept saying, we get our funding for aged care for these chronically older homeless people through the mainstream aged care funding platform, not through homelessness. And I think we need to listen to that and embrace it, because we need to, rather than trying to knock on the door as a residual system in homelessness and housing, we have to insert ourselves into mainstream, and this issue into mainstream and universal service. We need to develop clarity and expertise about our role and scope. What's our role, what's their role, and what's our shared role? And to this I would just say that what we need is to assist people. Our role is not to provide the services that the mainstream does. It is simply not. Our role is to support people to transition to the mainstream. Our role is not to dabble in education, because we're not experts in it. Our role is to enable people to be part of the mainstream. There is a significant role in supporting that, but it is not to take the place of other experts. Whether we like it or not, our role is to develop expertise in housing solutions, and that requires looking at things that we have typically not had expertise in: financing models, taxation reform, those sorts of issues. We need to rethink our partnerships, and I've only got 3 or 4 more to go, Andrew, and then I'm done. We need to rethink our partnerships. Our partnerships cannot only be with the service sector, they need to be with the community, with business and philanthropy. That's where innovation's going to come from, not through government contracts. We need to really rethink our partnerships with community and look to alternative funding sources. And we need to fully explore alternative approaches to practice. I've got to the point where I just want to put my fingers in my ears and scream if I hear case management again. And I know it's a damn good thing, but honestly, I think it's time for us to rethink, is case management the only way that we can work with people? And we need to develop an evidence base about what works. We really do. But that evidence base, we have to be smart about it. We need to evaluate our services, but not dicky evaluations. We need to pick the ones that we really need to focus on, and we need to invest, and that investment needs to come from government and Treasury. We have to refocus our advocacy away from the sector. And when I said this in Melbourne, and Glenda's in this audience from Homelessness Australia, said we've got to stop going to the Homelessness Australia conference. Well, I've revised that after speaking to Glenda. We've got to go to the Homelessness Australia conference, but equally importantly, we absolutely need to start going to other sorts of conferences, because how are we going to insert homelessness into the mainstream and universal? By going to the local government association conferences, by going to employment conferences, by going to education, to going to vet conferences. And finally, in setting up our innovative services, we need to think about governance, governance, governance and governance. And I made the point about where the policy reform sat in the authorising environment for the policy environment. The same is true in the programmatic space. We need to have people at the table who can authorise and insert the issues into mainstream and universal platforms. I'll just give you this one example of FOIA that we've been doing in Education First Youth FOIAs in Melbourne. We've had at the table in the governance, and I think it's the single most important thing that we did in that program and project, which is we had education and early childhood department at the table, seeing it as their issue, fundamentally as their issue, a youth response, as well as the housing and homelessness response. And then we had industry groups, employer groups, as well as Premier and Cabinet. And so nothing short of getting the governance right is going to create an authorising environment for policy and for practice reform. Thank you.
Thank you very much.